Hey everyone, Sarah Strackhouse here with RNCN, and of course I'm here with nurse practitioner Elizabeth Atchason. How are you?
Good, very good. Thanks for having me
back. Yeah, absolutely. I'm so excited to talk about what we're talking about today, women's health, when it comes to testing, screening, when, how often. These are questions that I feel like I always have, but I just don't know who to ask them to, or I just forget to ask them.
Yes.
Do you see that a lot?
Yes, a lot of patients come in with questions, or they don't even think. They come in for their physical, and they don't think to ask about specific screening questions that they might have. And so generally, as the practitioner, when somebody comes in, depending on their age group, you should be giving those suggestions and asking them if they've had any of that testing done.
Well, let's kind of start off with the basics of physical, and we're in an exam room, right? And we can kind of take a look around. Okay, so not too intimidating or anything like that. You know, we also, by the way, we have Valerie behind the camera who's helping out. If you want to give a little wave. So if you see us kind of going around, we're able to see everything here. So this is the exam room. So tell me, how often should people be getting physicals? Because I always forget, to be honest.
I really think it's a good idea to get a physical every year. There can be things that you don't know that's going on with your body, and that a doctor might find, and it's always good to catch things early. Generally, most people are pretty healthy in their 20s and 30s, so definitely by age 40, I suggest to all patients they should be getting their physical every year.
Okay. And what about kind of moving specifically into women's health? What are some of the tests that we should be getting, and maybe starting, as young as in your teens and, moving upwards?
Yeah, and so in your 20s, generally, so we talked about physicals, and I was just mainly referring to a general physical. But when you're talking about women's health, and you're talking about 20s and 30s, I suggest a pap smear at age 21, and then there's specific guidelines that go along with that. And that's just based on the research that's been done and the guidelines that have been put out there. And so it kind of starts with that, the female exam.
Yeah, absolutely. And how often, you're talking about guidelines, or how often should we be getting them, or does it depend on the person, the situation, the activity of their life? What do you think? Or is it, or is there a specific year, amount that we should be getting them?
I mean, it's
how often? Yeah,
the pap smear.
Yeah.
Okay. So pap smear, the guidelines suggest, like I said, 21, and then they've changed throughout the years based on research and what we have learned about the growth of cervical cancer and what causes cervical cancer. So before, some women, they started pap smears earlier based on if they went on a birth control pill or based on choices that they made, and then they changed that to 21, and they suggest that you get the pap smear, and I suggest this to my patients, every 3 years. Until you're age 30, and now they're suggesting that if you get an HPV test, which is a virus that can cause cervical cancer, and that is negative, then you may push out the pap smear to every 5 years after age 30.
Okay.
And there are different guidelines sometimes from different organizations. You've got the American College of Gynecology, you've got the American Cancer Society, you have the U.S. Task Force. So it's good to kind of look at that, but really it's important to talk to your doctor and look at your risk factors and what affects you as far as medication you could be taking that could put you at higher risk for cancer, and then determine maybe you need it sooner than their recommendations. And then I will add that at usually about age 65, we kind of stop doing the pap smears, especially if a patient has never had a history of HPV or cervical cancer.
Okay, that's really good to know. Definitely, moving forward. What about what are some other tests that as women we need to get that we might not be on our radar?
Yeah, so another test is the mammogram, and that starts later. And again, there's different guidelines based on the different groups. They just vary a little bit, I would say. I recommend patients at 40 start getting them yearly. And they're coming out with more accurate mammogram tests. There's a 2D, now there's a 3D.
Wow. So what does that mean exactly, 2D, 3D?
So 2D is like a two-dimensional picture, and 3D actually takes it in slices. So if you have a thicker breast tissue, you can kind of see through the thicker, or patients will say, I have densities, dense breasts, fibrocystic breasts. It's easier to see. They are a little more expensive, but what I'm reading is that Medicare is paying for that now.
Wow.
So that's good to know.
Yeah.
And it's just more accurate. And there's a low radiation 3D test.
Wow.
And so that has been a concern on some people's minds. Is it necessary to get this mammogram every year? And I always tell patients, yes. We're exposed to radiation all over the place, and so that's usually their main concern. And why should I get it every year? Could I be exposed to something? And I tell them it's very important to get it, because I've seen patients that have skipped a couple years of a mammogram, and then boom, they had breast cancer.
Wow.
And if maybe we could have caught it sooner if they had gotten those.
Right. Are there any cases where you should be getting it earlier than 40?
Yes, there are. Some women are at higher risk for breast cancer based on family history, so it can be genetic. It also can be certain medical conditions and certain medicines that lower your immune system. And so that is all up to your practitioner who knows your history. But there are some questionnaires and screenings online where you can put in your family history. It can tell you if you have a higher risk and what percentage, and then you can take that information to your doctor and see if maybe you need a different type of screening or earlier. Kind of a good rule of thumb is if a parent or grandparent had breast cancer 10 years before they started having breast cancer, generally about 30 then those patients will start screenings, not usually earlier than that. So they would start around 30, and then a regular normal patient that's not high risk would start around 40.
I see. Okay. And then after, besides, the mammogram and the pap smear, are there other tests that, again, might not just be on our radar that we should be getting?
Well, when they do a pap smear, they do a pelvic exam to check the uterus and ovaries. And so sometimes we order ultrasounds if somebody is at high risk for ovarian cancer or uterine cancer, or just having that checked by the practitioner when they're doing the pap smear is important. There's self-breast exams, and that's actually something that the patient can do on their own, but it is helpful to have a practitioner do that when you go in for your physical, especially every year. I think after age 30 when your breast cancer risk increases. That way, somebody professional is looking at it and can tell the patient what is normal and what's abnormal. So when they're doing those exams by themselves at home, they know kind of how to detect what's different and when to go into the doctor. And then there's also a bone density scan, which is a women's health screening for low bone density. And that is usually in the 65 and older age group. Okay. And that's looking for osteoporosis and osteopenia. Oh.
Well, how important is to catch something like that, or catch breast cancer, catch this stuff early?
Well, I mean, anything, and well, first, you start with primary prevention, being healthy, knowing your family history and all of that, taking care of yourself, exercising, getting a good sleep, eating fruits and vegetables. But then I
think sometimes we forget that all those basics come into play in our entire lives for the rest of our lives.
Oh, definitely. And stress management. I don't know that I hear enough people that they say, oh, stress isn't good for you, but they don't really understand how much that plays a role in fluctuating hormones and then putting you at risk for different types of health conditions and cancer. Wow. And then getting that screening is important because if you catch something early, a lower stage cancer or a health condition early, it's more treatable and more curable.
Wow. Okay. I actually recently heard something. I think it came out last week. A study talking kind of about what was it? You might not need chemotherapy if you get certain tests after breast cancer or something like that. And I always think about kind of the evolution of learning and everything. You're talking about the guidelines changing. Are there ways that we can kind of stay up to date? Are there resources that we can find to make sure that we're always kind of evolving with technology and science and learning?
Well, yeah.
And I know you have a blog actually coming out too, right?
We're going to post a blog of just general information about screening, and then I'm going to actually have links to.
That's great.
For people who have high-risk breast cancer, want to know if they are high risk for breast cancer, for people that just want to know all the different guidelines, what the different organizations say, and what exactly they say. So it's a little bit easier than me explaining all of it in every single guideline.
And we'll post that underneath as well, of course.
Yeah.
And make sure that the link goes there as well.
Yeah.
And, how important is it to also trust your, whoever's doing the exam, trust your doctor, your nurse practitioner? How important is to find someone that you kind of click with and get along with and agree with?
That's very important. Yeah. And you can ask your practitioner, if how often they're reading research, how often they're keeping up on the guidelines, what are the newest guidelines, and they should be able to answer it pretty easily.
Yeah.
And so if they are able to do that, you can have more confidence in them.
Yeah.
But you can look up yourself just by searching, keeping up on the web, every couple years.
It's a beautiful thing now, right?
Yeah, thank goodness. What do we do without technology
Right?
in that case? And you could pick one, like the American Cancer Society or the American College of Gynecology. Actually, they kind of encompass everything.
Okay.
Versus American Cancer Society would be more specifically for cancer. And you could search on there every few years and just kind of see if they're posting new information, because they would have the most up to date.
That's really great. Are there any questions that? Do we have a comment or a question? All right, I'm going to turn the mic to Valerie. Valerie, what are we asking here?
Do you recommend 3D exams?
Oh,
I do.
Okay,
I do.
So, and I know you kind of broke it down a little bit for us. Tell us a little bit more about it and why you think 3D versus 2D.
Well, 3D, like I said before, it breaks the tissue more in slices, and so what you're going to see just a better picture. When you do just 2D and you're just doing a two-dimensional picture, if you're 3D, you're going to see more in between. If that's explaining that, if that's a very good way to explain that. And
it makes sense.
So if you have thickened tissue, you're going to see in the middle, because they always talk about how mammograms are very good screening tools, but there's a certain percent, like any test, that is going to miss. It's going to miss certain cancers, early cancers. Maybe the very earliest kind. And then, like I said before, you have the women with the thicker breast tissue. That's actually very common because women are birth control, and which thickens the tissue and causes more cystic changes. And so getting that 3D test and getting that different kind of in the middle look at the breast, I think, is better. And right now, the research is suggesting the accuracy is a number of percent better than 2D. But then with the lower radiation, I just really think it's a good idea for everybody.
Yeah, absolutely, definitely. The great question too, as well. Are there any other questions that you kind of get from people a lot that we kind of haven't covered? Any that you frequently hear, or have we talked about most of them?
Well, a couple things. Like the mammogram, there's some women that want to know what a diagnostic mammogram is. That is a mammogram with an ultrasound. And they're trying to find areas that they can see better that the mammogram is not looking at well enough.
Okay.
And so we will do that, like if a patient actually has a mass. Or some women in the past had done that for thicker breast tissue.
Okay.
So that's one thing. Another thing that a lot of women ask is, what other testing do I need? Because there's the women's health testing, but then we have other issues that we share with men. In fact, when we were talking about the DEXA scan and osteoporosis, men do suffer from osteoporosis.
Yeah.
And then you have heart disease, and you have thyroid issues, and you have diabetes. And so those are important things, too, to make sure that that your doctor's talking to you about, whether you need lab work every so often or every year, an EKG to check for heart problems, going through your family history, being very thorough with your doctor on your family history so they know what screenings to do when.
So when you say kind of go through your family history with your doctor, is that kind of asking, relatives and parents and kind of knowing what diseases they've had and cancers and stuff like that?
Yes. Okay. So most forms that you fill out when you go to the doctor will say, list the different relatives and what are their health conditions. Allergies, autoimmune, thyroid, diabetes, and cancers. And then you usually have a section where you can put anything additional. And just making sure that on your first visit that your healthcare professional actually asks you about those and goes through those and puts them into your chart. Most people do that, I feel like that anymore. And that way they're knowing all the information so they know, that maybe if you need to be screened earlier, that they're bringing that up to you.
Absolutely. That's wonderful.
Yeah.
Any other questions that we're getting underneath? Have we answered everything? Awesome. Anything else you want to leave people with?
Just remember to talk to your doctor. If you don't want to look up all the different screening, the guidelines, get your physical, talk to your doctor about what they recommend, and getting that physical frequently, even every year, even if you're under 40, but when you're over 40, making sure you get that every year. You're talking to them about, am I getting my screening? What screening do I need? And then you can get that accomplished. Because letting that go, unfortunately, we get those patients that let things go, and then they end up finding out that they have a problem that could have been treated earlier. So, yeah.
Okay, great advice. And of course, we do have Johnson Medical Associates tagged up at the top there. And this is Elizabeth Atchason. If you have any other questions, feel free to post them underneath. And then make sure you look out for her blog. We're going to be posting that whenever it's kind of up and ready. We're going to be posting it just underneath there. So thank you so much.
All right, thank you so much.
All right, have a great day.